Welcome to the Banker Lamp. Please enjoy the video.
You start by prepping correctly. Wash your hands and make sure the target skin is clean and damp. Once done, wet the area with lukewarm water to open pores gently. Avoid hot water that dries skin. Apply Dr. Wong Sulfur soap, creating a light lather, and leave it on for 20 to 30 seconds while massaging in circular motions. Rinse thoroughly and pat dry with a clean towel. This first wash reduces oil and bacteria, so the ointment will absorb better. Now you move to the ointment. Take a pea-size amount of Bioderm Ointment for a small lesion, scaling up modestly for larger areas. Make sure the skin is dry, then apply a thin, even layer and rub gently until it absorbs. Once applied, allow the ointment to sit without occlusion unless advised otherwise, because it needs contact time to work. Use it once or twice daily per instructions, and make sure to avoid contact with eyes or mucous membranes to prevent irritation. To finish, you should moisturize if needed and apply sunscreen to treated areas when exposed later, because both products can increase sensitivity. Once done, monitor response for 1 to 2 weeks. Make sure to avoid harsh scrubs, alcohol products, or heavy makeup that can negate progress. If you see excess dryness or redness, reduce frequency to once daily and use a gentle moisturizer. If severe irritation, spreading lesions, or no improvement after 2 weeks.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.